Does everyone become blind due to diabetic retinopathy? This is a question I have been asked by so many patients. I see so many patients who are so worried that they will lose their eyesight just because they have been diagnosed to have diabetic retinopathy. This video is for you. I'm Dr.Anina Abraham from Advanced Retina Care, Hyderabad. First of all, you need to understand the stages of diabetic retinopathy. And why is it that it is important to get your retina screened if you have diabetes? In the early stages, you will only see something like this on the retina. You can see some yellowish spots here, which are called hard exudates. These are nothing but cholesterol deposits on the retina. You can see some amount of bleeding here. You can see some whitish areas, which are called cotton wool spots. So basically, this is the condition of the retina in a person who is having a moderate NPDR. It is more or less an early stage in the disease. If you have been detected at this stage also, there's absolutely nothing to worry about because your vision can be well preserved. Remember, if you have been treated, if you've been diagnosed on time, you will not become blind due to this condition. If you do not get diagnosed at that stage, and if you go to the doctor much later, you could have bleeding inside the eye. Now this, what you can see here, is an area of blood on the retina. We call it a pre-retinal hemorrhage. This means there are lots of new vessels growing on the retina which have broken, and that's the reason why there is bleeding on the retina. So you don't want this stage. It is before this stage that we treat the retina with lasers and injections. So this is already a stage of PDR, or proliferative retinopathy. Now, you need to understand, even at this stage, vision is almost normal. And that's the reason why patients don't go to the doctor. This is finally a stage called vitreous hemorrhage, in which bleeding has happened inside the jelly of the eye, inside the vitreous cavity. And this is the stage where patients complain of complete blurring of vision. They see some red spots in the vision and eventually it becomes completely blurred. Again, this stage can be treated with injections and even surgery, and your vision can be restored. You don't have to worry about becoming blind just because you have a vitreous hemorrhage. It is important, however, if your bleeding happens often, you need surgery. At this stage, surgical expertise is also very important. What you don't want is this stage in the disease. This is a retinal detachment due to diabetes. We call it a tractional retinal detachment. So in this stage, as you can see, there are membranes here all over the retina which have pulled up the retina. You will need a major surgery for this. The membranes will have to be removed. Oil will have to be injected inside the eye. You'll be given a position to lie down in. And again, there are cases which do very well after surgery, but trust me, you don't want to reach this stage. It is always better to get operated early and go home seeing.